My name's Shelly. I'm 14 years old and I have long black curly hair. By just looking at me, I may look normal, but really, I have cystic fibrosis. In 1938, Dr. Dorothy Anderson in New York Babies Hospital provided the first clear description of cystic fibrosis. And in 1953, Paul D. St. Agnes realized that people with more salt in their sweat have cystic fibrosis. In 1985, they found that the main chromosome defected is chromosome 7.
Cystic fibrosis is a hereditary disorder affecting the exocrine glands. It causes the production of abnormally thick mucus, leading to the blockage of pancreatic ducts, intestines, and bronchi. It often causes many respiratory and digestive infections. Normally, mucus is slippery, watery substance made by the lining of some body tissues. Cystic fibrosis is the most common fatal genetic disease affecting Canadian children and young adults. It is estimated that 1 in every 3,600 children born in Canada have cystic fibrosis.
Cystic fibrosis is a genetically inherited disorder. Cystic fibrosis is caused by a recessive allele. Both my parents are carriers for cystic fibrosis, therefore their genotypes are heterozygous. I received one recessive allele from my mom and one from my dad, leaving me with the homozygous recessive genotype and cystic fibrosis.
When two parents who are carriers have a child, there's a 25% chance that the child will be born with cystic fibrosis. There's a 50% chance that the child will be a carrier, and there's a 25% chance that the child will be neither carrier or have that trait. Think of it like bubble wrap. When the baby's in the womb, the lungs form these cysts, or packs of fluid. This is called by the cell membrane, stops letting in the salt, which makes the mucus thick and dry, so it blocks the airways and causes breathing and digestive problems. So the methods for diagnosing this is a sweat test. So you test the amount of salt present in your sweat. If it's positive, then you go ahead and test for the amount of the enzymes that are in your intestine. Another way is prenatal testing. So it samples both of the parents' DNA and from inside the mouth. And the third type is newborn testing, which you prick the heel of a newborn and place the blood on a girthy card, and that gets shipped off for testing to see if they're positive for cystic fibrosis.
Respiratory signs and symptoms. The thick mucus associated with cystic fibrosis clogs the tubes that carries air in and out of your lungs, which causes digestive signs and symptoms. The mucus can also block tubes that carry digestive enzymes from your pancreas to your small intestine. Without these digestive enzymes, your intestines can't fully absorb the nutrients in the food that you eat. Poor weight gain and growth, intestinal blockage, particularly in newborns, vitamin deficiency, and malnutrition are all serious side effects and symptoms of cystic fibrosis. Causes the body's sweat to become salty. The significant loss of salt during sweating can upset the body's balance of minerals. Because of this, it causes dehydration, increased heart rate, fatigue, weakness, decreased blood pressure, and the possibility for a heart stroke.
No cure for cystic fibrosis. However, specialized medical care, aggressive drug treatments, therapies, proper nutrition, and exercise can lengthen and improve the quality of life for one who is affected with the disease. The advances in research, treatment, and care have extended the average lifespan of people with cystic fibrosis. In 1955, a child with this disease was not expected to live long enough to even attend grade school. Today, the life expectancy can range from 40s, 50s, and even beyond.
Thank you to all the doctors who have been helping me get through my condition, and thank you for listening to my story. Bye.